So hello students, very good morning to everyone. And in the last lecture, we are started with the new chapter, that is anti-diabetic drugs. So these are the points that we had covered in the last lecture. That is definition of diabetes mellitus. So diabetes mellitus is a chronic metabolic disease caused by variable combination of two pathogenetic factors, that is insulin deficiency and insulin resistance. So the result is disorder utilization and storage of insulin. So the protein and fats are so this result in disorder utilization and storage of carbohydrate, proteins and fats, and reduce the production of energy. The different cell of pancreas produce different compounds and which have different function. So pancreas having three different types of cell, that is alpha cell, beta cell and T cell. So the function of alpha cell is it produces glucagon, which promotes conversion of glycogen into glucose when required to meet the energy need of the body. Then the function of beta cell is produces insulin, which promotes the excess of glucose from the blood and convert it into glycogen. Then the function of D cell is it produces somatostatin, which maintains a proper proportion of insulin and glucagon. So in normal person, there is a coordination in the functioning of this cell, but due to the onset of diabetes, the equilibrium is disturbed as insulin is not produced or it is in an insufficient quantity. So insulin controls the metabolism of carbohydrate, lipid and proteins. In absence of insulin, glucose is not metabolized at the normal rate. Hence, there is an increase in the concentration of glucose in the blood, causing the condition called as hyperglycemia. Thus, the blood glucose level rises above the normal level, which is 60 to 90 mg per 100 ml. So again in the last lecture we had learned the symptoms of diabetes. So the symptoms of diabetes are due to higher blood glucose concentration, the osmotic pressure increases, and due to this there is an increase in a blood volume and consequently the urine output increases, that is called as polyuria. And the second symptoms is the loss of water from the body leads to increase in a thirst, that is called as polydyspepsia. Then as the blood glucose level exceeds its renal threshold, glucose appear in urine, that is called as glucosuria. Then the ketone bodies appear in the blood and urine, that is called as ketonemia and ketonuria. Then the glucose cannot enter some tissues and the energy is derived by breaking down of protein and fats as alternative. This results the muscular weakness and weight loss. So uh, then the next symptom is in chronic cases there is a degeneration of the walls and membrane of blood vessel, especially fine capillaries in a limb, and causes the condition called as diabetes foot. Then in a long standing diabetes, increase in pressure on an eyeball that leads to blindness. Then again in the last lecture we had learned the types of diabetes. So it's classified into four types, that is type 1, type 2, type 3 and type 4. So type 1 diabetes is also called as juvenile onset diabetes. In juvenile onset diabetes, the hyperglycemia, glucosuria, polyuria and polydyspepsia develop rapidly. These diabetes lack the ability to synthesize and secrete insulin and depend on the administration of insulin for survival. Type 2 or maturity onset diabetes, this form offers people over 40 and the symptoms develop slowly. Obesity is often a contributory factor. This type of diabetes can synthesize and secrete the insulin, but it is in an insufficient quantity to sustain a normal metabolism. So This is the milder form of diabetes with less ketosis. The disease can be controlled by dietary regulation with or without use of oral anti-diabetic drugs. Then the third one is type third diabetes. It also be used. It is caused by the indirect factors such as abnormalities in insulin receptor, then pancreatic disease, and hormonal imbalance, and it may be induced by prolonged use of highly potent and toxic drugs. So this type third disease diabetes can cause due to some highly potent and toxic drugs, and it is caused by indirect factors such as abnormality in insulin receptor, pancreatic disease, and the hormonal imbalance. Then the type 4 diabetes, that is the disease may remain dominant and the symptoms may develop suddenly, uh, and the manifest itself some gestational period triggered by some factors such as acute tension, and this may be treated by proper diet only with insulin for certain period. Then again in the last lecture we had learned the types of hypoglycemic agent. So the first type is insulin therapy. So in insulin therapy, the insulin, it is one of the hormone consists of two polypeptide chain having 21 and 30 amino acids, alpha amino acids, which are held together by disulfide SS linkage. Insulin is mainly extracted from bovine, beef, and pork from porcine insulin and then purified by crystallization. Human insulin is now produced by recombinant DNA synthesis, in which human genes for insulin are inserted into E. coli to produce recombinant insulin. For example, the examples of recombinant insulin is Lispro, then aspart insulin, glargine. So these are the examples of recombinant insulin. Then insulin, it is used to control hypoglycemia in diabetes mellitus, and it is called as hypoglycemic agent. Insulin has to be given by injection through subcutaneous route. It cannot be given by oral route as it is protein and hence get digested by enzyme in gastrointestinal tract. Insulin, which is injected directly into the systemic circulation, and hence it is more effective than the oral hypoglycemic agent. So again in the last lecture we have learned the different dosage form. So it classified into rapid acting, intermediate acting, and long acting. So the rapid acting is insulin zinc suspension, intermediate acting is globulin zinc insulin suspension, then the long acting is protamine zinc insulin suspension. Then again in the last lecture we have learned the drawbacks of insulin therapy. So the drawbacks are the success of insulin therapy depends on the purity of insulin, sterile state of syringe, and the way the injection is given. The treatment with insulin may cause cardiovascular and renal problems, and the improper method of insulin administration may affect the vision, which may lead to cataract and even blindness. Then the next drawback is the injection of insulin, which is a protein, may cause allergic and hypersensitivity reactions. Small benign tumors may develop, that is called as lipodystrophy, and at the site of injection, which slows down the absorption of insulin. Bovine and porcine insulin are antigenic. They generate insulin antibodies. Human insulin is less antigenic. These antibodies bind with insulin, which decreases its effectiveness, and this leads to insulin resistance, especially when insulin is not highly purified. So these are the points that we had covered in the last lecture. Now the students, today we are going to learn the drug that comes under the oral route, that is the drug we are taking by oral route. So that is oral hypoglycemic agent. So these are the drugs that these are the drugs that can be taken by oral route of administration. So it classified into four classes. So the first class is sulfonyl urease class, And the example of sulfonylurease is glibenclamide. This is the structure of glibenclamide. It having this urea C double bond to NH2 and this sulfonyl group. So it says sulfonylurease derivative. And here is your CH2 and this CH2 attached to this ring. And this is the box of tablet of glibenclamide. And the uses of this glibenclamide is it is a highly potent oral hypoglycemic agent without having toxic side effects. It is found to be 200 times more potent than tolbutamide, which is this your sulfonylurease derivative, and it belongs to the class of sulfonylurease. And the uses are it is used in the treatment of type 2 diabetes or maturity onset diabetes, and it cannot be used in type 1 diabetes. So this glibenclamide cannot be used for the treatment of type 1 diabetes. And the side effects are, apart from usual abdominal complaint, it may also causes jaundice and eosinophilia. So apart from usual abdominal complaints, it also may causes your jaundice and eosinophilia. So so this is about the first class sulfonylurease. This is the structure of example of this class glibenclamide. And the uses is it is mainly used in the treatment of type 2 diabetes or maturity onset diabetes, and it cannot be used in case of type 1 diabetes. And the side effects are, apart from abdominal complaints, it also may causes jaundice and eosinophilia. So this is all about sulfonylurease. So the next slide, the second class is biguanide derivative. So the example of this biguanide derivative is metformin. So this is the structure of metformin: NH2 C double bond NH, CH2 C double bond NH, and CH3 and this is the box of metformin tablet. And so this metformin belong to biguanide class of compounds. And the uses is metformin is mainly used in the treatment of type 1 diabetes or juvenile onset diabetes, and it can also be used along with sulfonylurease, that is in combination therapy. For example, glibenclamide in combination therapy in management of other type of diabetes. So you know that this glibenclamide, this one, it is you are not used in the treatment of type 1 diabetes. So in combination with this metformin, it can use for the treatment of type 1 diabetes. So in we can the doctor are preferring for and doctor is preferring in combination therapy in management of other type of diabetes. And the side effects are it causes abdominal discomfort, muscular weakness. It causes abdominal discomfort and muscular weakness. These are the two side effects. So this about the second class biguanide derivative, and the example is metformin. And metformin is used in the treatment of type 1 diabetes and or juvenile onset diabetes, and in combination with other drugs it can be used for the treatment of other type of diabetes. So it can also be used with sulfonylurease, that is glibenclamide. The side effects are it causes abdominal discomfort and muscular weakness. Then here in the next slide, the third class, that is Pyranose. And so this is the Pyranose moiety, and the example is dopagliflozin. This is the box of dopagliflozin tablet, 28 film coated tablet. So it's having this Pyranose moiety, that's why it comes under the class Pyranose. Example is dopagliflozin. And the use of this dopagliflozin is it is the drug of gliflozin class and used in the treatment of type 2 diabetes, that is maturity onset diabetes. So this dopagliflozin is used in the treatment of type 2 diabetes, and the side effects are it causes abdominal discomfort, muscular weakness, heavy glycosuria, rapid weight loss, and tiredness. So these are the side effects of this dopagliflozin. So this dopagliflozin is the derivative of pyranose, and it is used in the treatment of type 2 diabetes. And the side effects are it causes abdominal discomfort, muscular weakness, and heavy glycosuria means the glucose body appear in urine, and rapid weight loss and tiredness. These are the side effects of this dopagliflozin. In the next slide, your thiazolidinedione derivative, it having this thiazolidinedione moiety. So an example of this thiazolidinedione derivative is pioglitazone. So this is the structure of pioglitazone, and this is the box of pioglitazone hydrochloride tablet available in its salt form. And the use is, it is diabetes drug used along with proper diet and exercise program to control high blood sugar in patients with type 2 diabetes. It works by helping to restore your body proper response to insulin, thereby lowering your blood sugar. And the side effects are sore throat, muscle pain, weight gain, and tooth problem may occur. If any one of these persist or worsen, notify your doctor or pharmacist. So this is about the thiazolidinedione derivative, and the example is pioglitazone. And we are going to see its synthesis also, so how it can be synthesized. So the uses is, it is a diabetes drug used along with proper diet and exercise program to control high blood sugar in a patient with type 2 diabetes. It works by helping to restore your body proper response to insulin, thereby lowering your blood sugar. Then the side effects are it causes sore throat, muscle pain, weight gain, tooth problem, and if any of these effects persist, notify your doctor or pharmacist promptly. So again, we are going to learn the synthesis of this pioglitazone. So this is the structure of this pioglitazone, and we are going to synthesize this by using these different chemicals. So the synthesis of this pioglitazone is start with the name of this compound is 2 in bracket 5 ethyl pyridine 2 L ethane 1 ol. Then in presence of 4 fluorobenzonitride. So this is 4. So here is a fluorine. Actually this overlap. It's here is a fluorine. So 4 benzonitrile in presence of sodium hydride. So we will get this product, and the name of this product is 4 in bracket 2 in bracket 5 ethyl pyridine 2 ethoxybenzonitrile. Then it is on reaction with ranitidine. It converts this C triple bond into C double bond OH. You will get this product. The name of this product is here. It's a big name. It is difficult to remember this name. Then this will undergo the reaction with this thiazolidine 2,4-dione. It's a 5-membered ring, then mildly basic condition as a piperidine. So this piperidine is a weak base. You will get this compound carbon double bond. So this CH2 will react with this aldehyde. You will get this carbon double bond compound containing product. Then it will undergo reduction with H2Ni in presence of NaBH4. So here the role of this NaBH4 or H2Ni is it reduces this carbon double bond into carbon single bond, and this is the structure of your pioglitazone. So since this is very simple, it's only 3-step synthesis. So these two compound will react, that is the name is here, in presence of 4 fluorobenzonitrile sodium hydride. You will get this product, and then this will undergo the reaction with ranitidine. You will get this aldehyde functional aldehyde product, then aldehyde containing product. Then this will undergo the reaction with this thiazolidinedione and piperidine. You will get this product. Then the simple reduction conversion of the double bond into single bond. So now next slide, we'll see the reaction mechanism of each step. So reaction mechanism, it is nothing but the step-by-step explanation of your reaction, how the bond formation and bond breaking takes place during the formation of product. So we'll see that in detail. For that I have to use this. So this is the interface of your camera. I'm changing orientation from portrait to landscape. So synthesis start with first I will reaction mechanism. Nitrogen, and hydrogen, and the name of this compound, just you can search its name, convert structure to name, so its name is this. Then this will react with sodium hydride. So the role of this sodium hydride is it acts as a base H, so it having this Na plus and hydride minus H minus, so that is called as hydride. So this NaH hydride takes this hydrogen, takes this proton, because this proton is this NaH acts as a base, and the function of base is it abstracts acidic proton, and you know that the proton present on this hydroxy group is acidic. So the bond pair shift on oxygen, so you will get oxygen anion, so in the next structure there will be a negative charge on oxygen, negative charge on oxygen, so negative charge, you will get this oxygen anion. So here first step is very simple, this NaH base it takes this proton, then the bond pair shift on oxygen, so there is a negative charge on this oxygen, so we will get this oxygen anion. Then in the next step is this will react with your 4-fluoro benzonitride, 4-fluoro benzonitride. So the structure of that 4-fluoro benzonitride is having this nitrogen, here is your oxygen, and here is your fluorine, nitrogen, formic acid, Ra formic acid, H2 hydrogen will add on this hydrogen, and you are having carbon hydrogen triple bond, so that one bond will break between this carbon and nitrogen. It's now HCO oxygen, we get this aldehyde. Now so the role of this ranitidine and H2 in presence of formic acid is that it converts C triple bond into this aldehyde functional group, C triple bond into aldehyde functional group. Then the next step is this will react with your thiazolidine 2,4-dione in presence of piperidine as a base. So on an arrow your thiazolidinedione and piperidine. So the structure of that thiazolidinedione, it having sulfur, nitrogen, double bond, and oxygen, NH. So this is the structure of piperidine. Now this will react with this thiazolidinedione and to for this piperidine. So this thiazolidinedione having this active methyl group. It having this active methyl group CH2 group, and the proton present on this carbon become acidic because it is attached to electron withdrawing group, sulfur and carbonyl. So these both are the electron withdrawing group, and that's why the hydrogen become acidic. And the role of this piperidine is that it acts as a base and it takes this hydrogen and generate carbanion. It generates carbanion. The role of this piperidine is it takes this hydrogen. Show that how it takes that hydrogen. So this nitrogen having lone pair of electron, it takes this hydrogen and the bond pair will delocalize on carbon. So there is a negative, so it generates carbanion. It generates carbanion. It generates carbanion. Generate this carbanion. Carbon having negative charge, so it generates this carbanion. And this now this nitrogen takes this proton, so it will become protonated nitrogen. Nitrogen having 4 bonds and positive charge on nitrogen. Now in the next step you will get this anion. Then the next step, this aldehydic functional group containing product will react with this carbanion. So your sulfur, oxygen, and a negative charge on oxygen. Now in the next step, it takes hydrogen from this base piperidine. So now this piperidine, now it is protonated pyridine, because after taking that hydrogen, it becomes protonated. So there is a 2 hydrogen attached to this piperidine. So this oxygen anion takes this proton and convert to OH. This two bonds, nitrogen, and to this nitrogen 2 hydrogens are attached, and there is a positive charge on this its lone pair when nitrogen. So once this O minus take this hydrogen, convert to NH, so hydrogen. So this nitrogen, it acts as a base and it takes this hydrogen. Nitrogen takes this hydrogen and bond will delocalize here, and simply loss of this H2O, and simply there is this is simply the loss of H2O. H2 to write H2 H2 PIO Pioglitazone. So since this is the reaction mechanism, it's a very simple reaction mechanism. So in the first step, this sodium hydride react with this reagent, so it having this OH group and hydroxy group. So the role of this NaH is it acts as a base. It takes this hydrogen and bond pair shift on oxygen, so it generates this oxygen anion. So this will react with this 4-chlorobenzonitrile. So this reaction is called as nucleophilic aromatic substitution reaction. So this nucleophile substituted this electrophile. It's a nucleophilic aromatic substitution reaction. So this replace this fluorine by nucleophilic attack. So it's a simple that it replaces this fluorine, and this oxygen will form bond with this carbon. So and this bond will delocalize here. There is a negative charge on nitrogen. Then this negative charge will delocalize here. It form carbon nitrogen double bond. Then this carbon nitrogen double bond, this double bond pi bond will delocalize here. This pi bond will delocalize, and fluorine is leaving group, and you will get this product. Then the next step is reduction of this carbon nitrogen triple bond, and the conversion of this carbon nitrogen triple bond into aldehyde by using ranitidine and formic acid. So the hydrogen add to this carbon nitrogen double bond, you will get this imine. Then this imine undergoes hydrolysis, you will get this aldehyde. Then this aldehyde react with your aldehyde react with your piperidine and thiazolidine 2,4-diene. So the role of this piperidine is it takes hydrogen and generate carbon, and that carbon act as a nucleophile, and it will react with its electrophile, and the electrophilic carbon is this carbonyl carbon. Bond will break, negative charge on oxygen, takes hydrogen from that protonated piperidine and stabilize that nitrogen. Then simply loss of water molecule base abstract this proton, and this the bond pair shift here, it form carbon carbon double bond, and this simply the loss of this OH, and you will get this carbon carbon double bond. Then the reduction of this carbon carbon double bond in presence of H2Ni. So this hydrogen add to this carbon carbon double bond, and you will get the final product, and the name of this final product is pioglitazone. So this pioglitazone, it is used to control blood sugar level in a patient with type 2 diabetes, and pioglitazone is used either alone or in combination therapy with metformin or glibenclamide. And the uses is it causes blood vision, anemia, retention, hypoglycemia, extreme tiredness. So these are the side effect of this pioglitazone. So these are the it causes muscle pain gain again. Along with this, it causes anemia, back pain. It also causes anemia, back pain. A side effect is anemia, back pain, blood vision, fluid retention, and hypoglycemia, extreme tiredness. So we have learned its reaction mechanism. Then thank you.